Hi, my name is Kirk Hamilton, your host of the Staying Healthy Today show. This is a show where we bring key experts, and sometimes I talk about topics that relate to nutrition, prevention, and integrative medicine for the individual, and also sometimes topics that deal with societal health in the world. And today, I'm pleased to have a cardiologist that I've just gotten to know, Dr. Daniel VanHamersveld, or Dr. Van as we call him. And he's joined us in our practice, and he has a big interest in endothelial function. So what we're going to talk today about is the importance of endothelial function. What is it? What nutrients, diet, and exercise can do for it from a cardiologist point of view. And also, I kind of want to understand why he transitioned to from a traditional cardiology practice to a more preventive, nutritionally oriented practice. So, Dr. Van, nice to meet you. How are you doing?
Thank you. Just wonderful. I appreciate it. Yeah.
Um, let's just start from the beginning. Your educational background, current position. Well, educational background, then your journey through traditional medicine, and then what made you make the hop, so to speak,
Yeah.
to integrated medicine.
Yeah. So I went to the University of Michigan and actually did all of my training there through all the way through internal medicine and cardiology fellowship. And I thought it was great, great program. And then I came to Sacramento right afterward just because there were not a lot of jobs available on the West Coast or East Coast. And there were several people that had come to Sacramento from Michigan because they actually started the original medical school at UC Davis in the 60s. So there was kind of a track. So I interviewed out here, got a job in private practice, and really enjoyed it. And worked for Sutter for 10 years, and then went back out on my own. And I was with a group called Sacramento Heart for 25 years. And so it it was good. I mean, medicine has its ups and downs. Private practice is disappearing, of course, uh, but about probably 8 or 10 years ago, I started seeing some of my patients who were, you know, intelligent and discerning were showing me things that were outside of what I was used to. Some natural supplements that were providing them great benefits. And so it got me thinking, and I started looking and studying, and I was realizing that, big pharma really runs the show. And their tentacles are everywhere. And so most doctors are not even really aware that big pharma owns the media, they own medical journals, they own the FDA, or used to have owned the FDA. And so to get outside of that mentality was so exciting and rewarding.
So let me ask you real quick. You said something very interesting to me that patience. So it wasn't like you had this, you were sitting there and you had this realization or aha moment. It's like patients started asking you when you talked to them, they were doing things, and that's what you started to lead you into the process.
Right,
In other
right,
words, they were taking a supplement or they were doing this or some kind of alternative treatment.
exactly. And they were showing me how it was helping them. And they were obviously reliable people that I trusted. So I would study what they were using, and it just opened a whole new door to me to say, whoa, wait a minute. You know, what, why are we thinking about a drug for every symptom or problem when a drug gives you one benefit without any cure and you got 75 possible side effects? Whereas with an intelligent supplement, you've got no side effects and multiple benefits, usually beyond what the purpose is for. So it was just a whole new world.
Let me ask you, like, what were a couple of the key supplements or therapies that people came to you first that caught your attention? That they said worked, and you go, why am I not using them? There's a couple. What were the ones that triggered your
Uh,
interest?
well, one of them was, of course, uh, higher dose vitamin C, uh, and you know, bigger doses of vitamin D, like 5,000 units a day. And there was a patient who was using a product from a company called Pharmanex, which I think is still around, but it was a special multivitamin supplement that it had, dozens of different things in it. It looked really impressive, and so this person had an unusual neurologic syndrome that this stuff really helped her a lot with. And I don't know which specific ingredient it was, but it just led me to look into it more, and I was pretty excited about it.
So you got in, those seem like those could be general nutrition benefits for vitamin C and D and the supplement. Did they have a cardiovascular benefit that it treated you, or just because they helped the patient
No,
sitting in front of
first
you?
of all, it was just in general. It wasn't specifically
Right.
cardiovascular initially. Yeah, but obviously with my specialty, that's what I wanted to get into, is what can we do to improve heart health, and mostly prevention. Nobody deals with prevention. The doctors just care about, show me your symptoms, I'll throw a drug at you. What about prevention? So you never get to that place at all.
So how did you start? So these people got your attention. So then where did you turn to start studying or learning another way?
So I found a lot of things on the internet. I found, people that I trusted, like Mark Houston, the cardiologist from Tennessee. Russell Blaylock is with Newsmax now, but he's a retired neurosurgeon who writes a monthly newsletter. Just a lot of people like that I started having confidence in, and it just changed my whole philosophy.
So you actually did the search on the internet kind of and just went through and searched out people like that.
Yes.
And then
Yeah.
you looked at what they said and it made some sense. All right. Well, you talked about endothelial function when we were chatting and how important it is. So maybe you could explain what the endothelium is first and how important it is, and then we can talk about the things that do good to it, bad to it, or whatever.
Yeah. So in cardiology and heart disease, the arteries, of course, are critical to everything. But as far as the heart goes, we talk about coronary artery disease, which is one of the biggest scourges we have, leading to heart attacks and so on. And that specifically deals with those three arteries around the outside of the heart that are getting squished, and each time the heart beats, so they're under a lot of stress. But the same arteries are everywhere. But the endothelium is kind of the critical boundary, because the arteries have three layers, and so the inner lining is the endothelium, and it's a very delicate single cell layer that is actually complex because it has multiple chemicals uh, in it and around it, and its whole purpose is to keep blood flowing smoothly in the lumen of the arteries, and to make nitric oxide to keep the arteries dilated and not restricted, and it provide a barrier to prevent disease or damage to getting into the arteries. So it's a critical structure, and our arterial system is huge. We have thousands of miles of arteries, and the area of the endothelium would be more than a tennis court, I'm told. So it's a huge amount of space altogether. And actually, we have inside the endothelium, there's a tiny little delicate layer called the glycocalyx, which wasn't even discovered until 30 years ago or so. So it's very delicate. It helps protect the endothelium, but it is very fragile. It disappears when you try to mess with it. And it's similar to, the idea is, if you ever go fishing and catch a fish and you touch the fish, it's very slimy. That's what the glycocalyx would be, is just this little protective layer. So both of those, the endothelium and the glycocalyx, can get damaged very easily. And So that's what we want to avoid. So
So,
what can damage the endothelium? Well, all kinds of things. Um, you know, a sedentary status, uh, smoking, uncontrolled high blood pressure, excess sugar, seed oils, just any kind of unhealthy lifestyle can damage the endothelium. And so, um, how does that happen? Well, one thing is oxidative stress. Okay, oxidative stress is a general term. It affects the way our body works. We make energy with our mitochondria. As a result of that, there are reactive oxygen species that are produced. Most of them are neutralized, but some of them persist. So that kind of process can cause some tissue damage, including endothelial damage. Also, if the endothelium suffers some insult, it's going to be releasing chemicals like cytokines and so on into the bloodstream that are going to start to attract things like white blood cells, which is not good. It's also going to attract other things to stick to the endothelium, and then white blood cells can actually get through that cell layer into the middle layer of the blood vessel and start to create plaque. So monocytes are a type of white blood cell that can get through the endothelium, and then if there is damaged LDL cholesterol in there, it'll gobble those up, and it becomes a macrophage, and it eats these damaged cholesterol particles, and this leads to a foam cell and leads to plaque material, and the macrophages themselves emit all sorts of bad chemicals. And so another factor would be LDL cholesterol, which people call the bad cholesterol, is really not bad, but it can get damaged. So if it gets oxidized from some of these processes we talked about, it then can become small and abnormal, and it becomes a target for white blood cells to gobble it up, get rid of it. But then that itself can end up in the endothelium if there's damage to begin with, and that can again contribute.
So, so you hear about large fluffy LDL cholesterol,
Right.
and so if the endothelium's not damaged, the cholesterol just keeps scooting on down and out of the body.
Correct. So
Kind of
cholesterol is LDL cholesterol is it's like a FedEx truck. It's put together in the liver. It's a large structure full of cholesterol and triglycerides, and it bounces around the bloodstream everywhere, delivering cholesterol and triglycerides where they're needed, comes back to the liver for another load. So everything's good. And the LDL particles are kind of like beach balls bouncing around. But the problem comes with oxidation, smoking, whatever's going to damage, excess sugar is going to damage the LDL particles. They get small and dense like golf balls. And then if there is some endothelial damage, they can get in there, or they can be eaten up by monocytes and get into the endothelium. So
let me see if I get this straight. The small LDL, because it's damaged large LDL, is that right?
Right.
So it can sneak through the cracks in the damaged endothelium, correct? Or the glycocalyx. And then when it gets underneath the endothelium, then the foam cell is created and causes atherosclerosis.
It's kind of self-persistent, yeah.
Right. So you and we've had discussions about, so I've observed that, when I do coronary calcium scores and things like that, someone can have a high total cholesterol or LDL, but if they have a small amount of small LDLs, often see really good calcium scores when they have a very low amount of small LDLs. And you shared with me about the triglyceride HDL ratio, trying to keep it below 2 or closer to 1. And they correlate with each other. The lower amount of the smaller LDLs, the less you have of the ratio, or the smaller the ratio. Is that kind of?
That's right. And it's kind of the poor man's way of looking at if your LDL particles are healthy and large, is a good triglyceride HDL ratio. Versus, you can send your blood to the Cleveland Clinic and get an exact number, But I love the triglyceride HDL ratio because if it's nice and low, like well below 2, then you can be sure your LDL particles are healthy and they're not atherogenic.
Right. Well, I think that's golden because, the simple lipid profile is like about
Mm-hmm.
$10, and when you have to send it
Yeah.
off, I do a lot of small LDLs. We got to send it off, wait for 3 weeks or so to come back. But you've taught me
Mm-hmm.
that. And so I look at that all the time and then I compare them just to
Yeah.
test it out. If
Yep.
there's low, small, if there's a low in both, then we're good. Okay.
Yes.
So let's talk about, we've talked about some things that can harm the endothelium and kind of how it works. So what are some of your favorite, well, let's start out with just diet. What kind
Mhm.
of diet helps the endothelium? And then we'll go to supplements and from there.
Right, right. Well, I think a Mediterranean diet is hard to beat. We're emphasizing lots of healthy, organic, fresh vegetables, fruits, uh, nuts, healthy meat, which to me would be again grass-fed beef or organic or pasture-raised things, animals, and in general, carbohydrates are not our friend. In part because of the fact that wheat is all different than it was 100 years ago. It's been genetically modified, and so the excess, the pastas, the excess sweets, just excess sugar in general is to be avoided. And I think we got into this huge mistake back in the 1970s when we had the faulty research that made it seem like cholesterol was correlated with heart disease. That brought us down the whole pathway of, okay, cholesterol is bad, therefore all fats are bad, therefore we better emphasize healthy carbs. And meanwhile, the drug companies can make the statin drugs to lower cholesterol because that's the bad guy. And then in the meantime, we've got this 40-year epidemic of obesity and diabetes and everything, heart disease, when it didn't need to be that way. So we really need, sugar is the real enemy. So we got to keep excess sugar out of our system, especially, uh, fructose, with high fructose corn syrup containing foods, because any extra sugar molecules in our bloodstream cause permanent damage. Sugar is very active. Glucose is very active metabolically, so it'll cling to anything it comes in contact with. And what's it going to come in contact with but the endothelium, because there it is in the bloodstream. So that causes a permanent, it binds to the cell membrane of whatever cell and permanently damages it. And so the diet needs to be fairly restricted in.
Well, let's pause here a second. So you said the Mediterranean diet. So, and you say sugar, and sometimes you say carbohydrate in one word, and that encompasses a lot of foods that are, for example, beans are in every
Right.
traditional diet that lives a long time. So, are you separating
No, let's
complex?
clarify. Yeah, I'm a processed carbs, basically.
Got it.
The pastas, the bread, that kind of thing. Vegetables and fruit um, have sugar, obviously, but it's incorporated into the structure, and the absorption rate with fruits and vegetables in general is much lower. The glycemic index is usually much lower in most fruits and vegetables. Yeah,
So carbohydrates that had a low glycemic index, you wouldn't be against. I'm talking about like a bean, a legume, lentils,
correct.
peas, that kind of stuff. Okay.
Yeah, yeah.
How about well, any other dietary things that you think are something that you want to make a comment on?
Yeah, I mean,
Harming
it's
the endothelium?
really important to stay away from unhealthy oils, especially
Got it.
the seed oils. They're all they are is omega-6. We eat way too many of those, and they oxidize quickly. So healthy oils like olive oil, coconut oil, avocado oil, and staying away from processed foods, fast foods. Trying to eat natural as much as possible.
So if you had somebody, because there's some people who coconut oil definitely makes their cholesterol go up. So you would just check the triglyceride HDL ratio or small LDL or something like that
Right,
as a screen.
right. There are a lot of healthy saturated fats out there. And again, I don't really care what it does to the cholesterol so much. It's what's happening with your sugar and what's happening with your triglycerides and HDL ratio. That's what's more helpful.
Well, I guess while we're here, before I get to nutrients, is how do you assess the endothelium? I forgot about that. It's my bad. How do you
Well,
assess endothelial function?
that's a good question because it's not an easy thing by just saying, oh, we're going to measure HSCRP or measure something. So one of the ways that has been developed, there's some devices that can non-invasively look at the health of your endothelium on the basis of how well your arteries dilate, after compression. How resilient are they? How flexible are they? And there are devices that can give you a good handle on that, both with your large arteries, the ones you can see and feel, and also with your arterioles, the small vessels. Both of them are important in your overall cardiovascular health. So they can be tested with non-invasive tools.
Would you ask for that if you were a patient? Did you just ask for vascular testing, or how could you be, more specific that a doc would know what you're talking
I
about?
would say, yeah, I mean, a lot of doctors are not familiar with this. Even a lot of cardiologists are not. So you have to say, what can you test my vascular system, with a machine? And if they don't have it or know about it, they would have to research it, I guess. But a lot of practices, especially more functional practices, are very much tuned into it.
So
Yeah.
arterial elasticity would be a decent term to throw
Yeah.
out there. Can you test my
Yeah.
arterial elasticity?
Yeah.
Got it.
Compliance, elasticity, and all that. Yeah.
And so that test can test both small vessels and big vessels. Can you explain that a little bit? What the significance of that is?
Yeah. So with the large vessels, um, you know, f- flow characteristics are, um, you know, the diameter is relatively large. There's not a lot of restriction to movement. And so if there's going to be disease in those vessels, it's usually going to be pretty serious restriction in flow or pretty serious stiffness. And in the small arteries that we call them the C2 arteries, these are much smaller. There's several branches down in the arterial tree, and therefore their diameter is smaller, and flow characteristics are much more dependent upon uh, whether or not there is any dysfunction in the endothelium, whether there's any blockage, because flow is the diameter is much smaller, and these vessels are the ones that bring oxygen to the end organs, to the eyes, to the kidneys, and so they can affect the final amount of flow that's actually providing the nutrients to our organs. And so um, that's why knowing what that is also critical. And that's actually having an abnormal C2 value is more prognostic of future cardiovascular health than having the C1 vessels be a problem.
So C2, okay, so I was a little off on that. So the C2 ones, I know that they're smaller blood vessels, but you're talking about that doesn't just mean it's in, let's say, you're in your brain in the small blood vessels. You're talking about in your peripheral. If you had peripheral vascular disease, the
Correct.
C2 would be reduced, their activity.
Uh-huh. Yep. Yep.
Yeah.
So yeah, and so we're happy we can test for both of them. Yeah.
So let's talk about some nutrients that might be able to enhance the function of the endothelium. We talked about diet and of course exercise. But what
Right.
about a few nutrients that people could try?
Well, there are a lot of different things, and I have a list that I give to people. And one of the things I'm really excited about is something called atherosclerotic, which came out just a few years ago, and it's of course all natural, but it has something called rhamnum sulfate, which is a kind of a complex carbohydrate or glycoprotein type substance that comes from a algae, sea algae, certain species. And it's got a lot of other extracts of various fruits and so on. And it's pretty exciting because it provides nutrition to the glycocalyx and the endothelium, and that rhamnolic sulfate has similar glycoproteins as to the glycocalyx. And there are studies that show that you can document significant improvement. For example, the carotid arteries here, they're very near the surface, so you can do detailed ultrasound studies to measure the precise thickness of any plaque in the carotid arteries. And you can do a trial of take a group of patients, take half of them take arterosil, half of them placebo for 6 months, and in 6 months, 30 or 40% of the plaque is gone in the arterosil patients. So it's very exciting, and that process is presumably happening everywhere. So I love that. There are other products. There's one called Vascanox. There's something called Neo 40. It's just something that specifically helps your arteries, your endothelium, make more nitric oxide all day long. Nitric oxide, as you know, is a gas that lasts for microseconds, but it dilates coronary arteries and all arteries, and so we want more of that going on. Helps blood pressure as well. I like things like aged garlic, very simple. Omega-3 fatty acids, fish oil are very helpful. I like curcumin. Curcumin or turmeric has over 500 benefits for people. Crosses the blood-brain barrier, cuts down inflammation in the brain, helps your arteries be smoother. Green tea is great, vitamin C, magnesium, N-acetylcysteine, quercetin, chelation, of course, is something that's been around for many, many years. And and it also gets rid of heavy metals. So those are some of the things I use or recommend.
So that's plenty of nutrients.
Yeah.
People walking out here. So we
And
got
there's
that.
more.
We got that. I'm sure there is. I'm sure there is. We know Mark Houston well, and that's a compliment. But how about, is there a type of exercise that's better for the endothelium, or it doesn't matter? You're just trying to get people walking.
Yeah. So that's a really good question. I don't know I can give you an exact answer to that. I think that in general, exercise is critical for many, many things, as you know. So I would say aerobic exercise would be my cornerstone. Try to get 150 minutes a week of walking, bicycling, treadmill, whatever works, whatever I'm more comfortable with. However, I do like resistance training as well to be another component. Maybe not as much, but resistance training is going to build muscle, and it's going to increase vascular flow to muscle. And I think by virtue of that, it's going to improve or at least help maintain endothelial health, at least indirectly that way. But so I think both are important. I really like aerobics, however.
I think we've got a pretty good snapshot of the endothelium and things you can do for it. Is there any other comment you'd like to make on the endothelium or cardiovascular disease in general as you exit?
Well, I think, yeah, it's, drugs are not the answer to everything. I mean, statins are a scourge, and we've gotten sidetracked to think that cholesterol is the problem when it's really not. And I really think we need to focus on prevention, do things to help our body stay healthy. And if we help our endothelium, we're going to help pretty much everything. So I just think that this thinking about the health of the endothelium applies to everything: the health of the gut, the health of the brain, the health of the liver. Things you want to do to keep it natural. Use intelligent supplements, and I think those are really lifestyle changes that are good.
That's awesome. Thanks for your time today,
You're
Dr.
very
Van.
welcome, Kurt. It was good talking with you.
I'll probably see you soon.
Okay.
And I'd like to thank you for joining this edition of the Staying Healthy Today show. Until next time, be well.